Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Respiratory-syncytial virus, RSV, Pediatrics. Introduction. Respiratory-syncytial virus, or RSV, is a virus that can cause an infection in the airways of the lungs. RSV affects most babies and children by the age of 2. RSV starts with symptoms like those of flu and colds. Then it turns into wheezing and coughing. In most cases, the child's body fights the infection and the symptoms go away. In some cases, the symptoms of RSV could become more severe. Knowing these symptoms is important so your child can get care quickly. This program is for parents with children who may get or already have RSV. It will give you tips for preventing RSV in your child. It will tell you what causes it and what the symptoms are. You will also learn how to treat it and when to call the healthcare provider. The lungs. RSV is a virus. It can cause an infection in the lungs. This section helps make it easier to understand infections caused by RSV. The lungs let us fill our blood with oxygen. The oxygen we breathe goes into our blood through the lungs. When we breathe in, the air goes through our mouth and nose and into our windpipe, also called the trachea. From the trachea, the air we breathe goes into a lot of little tubes called bronchial tubes. The smallest tubes are called bronchioles. All along the inside of our bronchial tubes we have a substance called mucus. The mucus helps trap dirt from the air we breathe in. The mucus comes out when we cough. Very small brushes called cilia protect the breathing tube and lungs. The cilia constantly push the mucus out of the lungs. If there is too much mucus, we cough it out. Causes.
The air we breathe has germs in it like viruses and bacteria. Our immune system protects our lungs from infection by fighting most germs. Sometimes, though, germs can get past the immune system and down into our lungs. When that happens, it can cause swelling in the lungs called bronchiolitis. When a child has bronchiolitis, the bronchioles may fill with mucus and other fluids. When the infection affects the whole lung, it is called pneumonia. In adults and older children, the bronchioles are wide because they've had time to grow. In babies and younger children, the bronchioles haven't had time to grow. They are still pretty narrow. That's why babies and young children have more problems breathing when their airway is blocked by mucus and other fluids. Most cases of bronchiolitis in children are caused by RSV. Antibiotics do not fight viruses. Healthcare providers usually cannot order antibiotics to fight bronchiolitis or RSV. Viruses that cause bronchiolitis are in the air we breathe and the things we touch, just like the viruses of the flu and cold. We can get them from other people. It usually takes a few days for a virus to cause an infection if the body doesn't fight it off. Bronchiolitis is contagious, which means it spreads from person to person. Preventing bronchiolitis is always better than treating it. You can help your child prevent viral infections through proper hand washing and by avoiding people who are sick.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms.
Signs and symptoms of RSV are like those of the common cold. Most cases of RSV bronchiolitis happen in winter and early spring.
Most children with RSV get some of the following symptoms: fever, chills, cough, runny nose.
These symptoms last about 48 hours. Then the child's cough usually gets worse. They may start wheezing.
Symptoms get better on their own in most babies, but sometimes they get worse. Babies may start taking fast, shallow breaths. It also gets harder for the child to breathe. This is called labored breathing. The child may also gasp for air. This can cause the nostrils to get bigger or flare. The heart rate can get faster. They can become irritable, tired, and sleepy. They may not eat as well and may vomit after coughing. The child may even stop breathing for short periods of time. As things get worse, the child may become dehydrated. This means the child does not have enough water in their body. They may not be able to fill their blood with oxygen. This can cause the skin and fingernails to turn a bluish color. In severe cases of RSV, the child may have to be admitted to a hospital. They may need to be placed on a machine that helps him or her breathe better for a short time. Self-care. Most cases of RSV last about 2 weeks, but some children may have a cough for a few more weeks. Most children get better on their own. You can make your child more comfortable by encouraging your child to drink a lot of fluid to prevent dehydration, having the child sit up to help with breathing, using a bulb syringe to make their nose less stuffy, especially before eating. You can give acetaminophen or Tylenol, but always read the label carefully to make sure you give the right dose. Do not give aspirin or medications that include aspirin to babies. They can cause serious side effects in young children. Do not allow anyone to smoke in the house. Ask him or her to smoke outside. Smoking can make the symptoms of RSV worse. When to see a healthcare provider. If your child's symptoms become severe, you should call your healthcare provider. Your baby may have to be admitted to the hospital and placed on a breathing machine. Severe cases of RSV can be life-threatening if not treated. Things to watch for are very fast breathing, breathing that is difficult and is making the neck and upper chest move differently than normal, high fever, coughing that's getting worse, not better, dehydration, more sleepiness than normal, blue color to the skin, lips, and or fingernails. A healthcare provider can usually diagnose RSV by examining your child and asking you a few questions. During the exam, the healthcare provider will listen to your child's lungs with a stethoscope to check for bubbling or crackling sounds. He or she will also listen for rumblings, which mean there's thick liquid in the lungs. Any of these sounds could mean they have an infection. Usually, no other tests are needed. Sometimes a chest X-ray or blood tests can be used to make the diagnosis. Treatment. If the child has complications from RSV, he or she may need to stay at the hospital. At the hospital, the healthcare providers will help the child breathe better. They may use oxygen or special breathing machines. Fluids can be given through a vein to prevent dehydration. Prevention. Babies who are at a high risk of getting RSV may be given a monthly shot for a few months to prevent RSV infections. Babies with a high risk of getting RSV are those born prematurely or with heart or lung problems. RSV is contagious. You can help keep your child from getting bronchiolitis and RSV infections by following good habits. Keep your child away from other children who are sick. Wash your hands with warm, soapy water. Scrub the tops and backs of the hands, underneath the fingernails, and in between the fingers for at least 20 seconds. If soap and water are not available, use hand sanitizer that contains at least 60% alcohol. This will help protect you and your child from germs. Wash your hands. 1. After you sneeze, blow your nose, or cough. 2. After going to the bathroom or changing diapers. 3. After touching garbage or animals, their waste, or their food. 4. Before and after caring for a sick person or cleaning a wound. 5. Before eating or preparing food and after you finish. Keep your child away from the toys or personal belongings of sick or recently sick children. Don't expose your baby to secondhand smoke.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. RSV is a virus. It causes lung infections such as bronchiolitis. It mostly affects babies and children 2 years old and younger. See your healthcare provider right away if your baby has any of these symptoms for more than a few days. Severe coughing spells, shortness of breath, trouble breathing, fever, drowsiness or tiredness, dehydration, blue-colored skin or fingernails. Preventing RSV infections and bronchiolitis is always better than treating them. You can prevent RSV by using good habits. Keep your child away from other children with infections. Wash your hands often with warm, soapy water. Keep your child away from the toys or personal belongings of sick or recently sick children. Don't expose your baby to secondhand smoke. Good habits can do a lot to keep your child healthy. You should still know what to watch for in case your child does get RSV. Call your healthcare provider's office if you have questions. Thank you for using Explain.